We were looking for something to add to our medical practices. I'm a physician, and we wanted to be able to do more for our patients. And we looked at X-ray, we looked at more laboratory, and then one of the docs said, why don't you look into this vitamins and supplements? Now, I really didn't know much about it, but it sounded like something I would listen to. And once I heard what they had to say and came to the meeting and understood the entire program, we were in. It was great.
One of the commitments that we made, my partner and I, when we opened our practice, was to stay at the cutting edge of healthcare. And we've always felt that incorporating high quality products was an integral part of the way we wanted our practice to run. And incorporating Amerisciences products fit into that scheme perfectly.
Well, I think it's very critical for physicians, particularly, to understand and really truly believe they're doing the right thing for their patients. And once you believe, and you can take them as a family, and your children are taking them, it's something that's just easy to predict that your patients are going to believe that.
And the scientific advisory board, I think, is key because, not only there do you have reassurance that the products that are being recommended to your patients are, of good quality, but you also know that there's other clinicians, other physicians that are looking at these products and making sure that they are what our patients need.
Well, it's actually something that that gets you very excited. I mean, to be involved in the vanguard of the nutrition and wellness industry I'm excited about not only educating my patients about their disease and creating kind of a better bond with the patient. Patients perceive that when I'm educating them about their diabetes and macular degeneration, they say, wow, he's actually looking out for my best interest. But what's great about the whole business side of Amerisciences is that it kind of gives hope to people who haven't had hope before.
The Amerisciences business model and products have allowed me to provide care to my patients that did not exist before. It's allowed me to expand the options that I provide my patients. It's allowed me to add income to my bottom line by providing the high quality products that I believe in to my patients. Because every time you go to a pharmacy or you go to a store and you pick up a bottle, and on the back of that nutritional supplementation it says, see your doctor and before you take this product, now I feel comfortable. Patients come to me saying, what should I do with nutritional supplementation? And I feel that's my obligation as a healthcare provider to provide them with that information.
We brought the Amerisciences products into our office about 3.5 years ago, and they've really done very well in the practice, and our patients appreciate the extra care and attention to their overall health and wellness and not just to their annual eye examination.
I like the fact that the positive thing, I'm tired after so many years of treating people that are already sick and trying to get well again. It's really good to work from the staying well end of things. So it's something that physicians don't get a chance to do very often. That's been a real positive, particularly as my career gets a little further along the curve. It's nice to do some positive things.
It is.
That part's been great.
And one of the really neat things about all this is to be in his practice, because like I say, I work with him, and to hear the patients after he's talked to them about the Ameriscience products come out and they'll ask, do you take the products? What do you think of the products? How do they make you feel? And they're so relieved to know that they can go to their doctor's office and have the answers to some of their questions about what should they take to help them feel better and get a better quality of life, get a better night's sleep, and not take some sort of pharmaceutical medication.
In today's environment, with healthcare costs being spiraling out of control and the reimbursements that healthcare providers are not seeing from insurance-based medicine, it is important, and it's been important in my practice, to bring a product line in like Amerisciences that allowed me to provide services to my patients that are cash-based and allow me to add to my bottom line as a practitioner to help me cover my overhead.
Certainly physicians across the country are seeing decreased reimbursements, and the added revenue that Amerisciences products and providing them to our patients provides has been excellent in trying to reduce the impact of those reductions in our income.
One of the great things about Ameriscience is not only what it's added to our practice in terms of patient satisfaction, but what it's added in terms of security of our practice itself. You know, with reimbursements staying the same and overhead going up, physicians all over the United States have seen their profit margins shrink and shrink and shrink. And after all, it is a business. You have to pay the nurses, you have to pay the rent, you have to, you know, pay for the medicines. It's true. It is true. And so we see our profit shrinking, and this has been a way for us to increase our practice income about 10–15%. So it's been a big, big difference, because if you're taking home 2% and then all of a sudden it's 10%, that's a huge difference.
Our Amerisciences business is really on the way to replacing the income from our optometry practice and allowing us to go forward with an improved lifestyle without the hassles of running the practice.
You know, I joined Amerisciences because I'm a junior partner at my practice. I felt like I wanted to add an additional revenue stream, and when I was first exposed to the Amerisciences product line, you know, I was told that I'd probably add an additional, you know, $2,000 to $4,000 a month to my bottom line. And in the last 3 months, I've more than tripled my income as an ophthalmologist, and I just can't believe it. You know, I still log into my bank account and look at it a couple times a day going, how is this possible? So it's very exciting to be involved with a company with such tremendous growth potential.
And I never thought in my wildest dreams that simply providing a product to patients, that you initiate a point of sale, the product is shipped continually to the patient every month, and I don't have to be involved in that transaction there, but I'm receiving residual income from that point of sale. It's very surprising, and it's very exciting.